I'm Phil Blauer. Happening right now, county officials providing their update on the coronavirus situation. This is a Fox 5 News special report. Let's listen on in.
Requiring that alcohol also be consumed by trade patrons while they're eating. In addition, today we are clarifying those businesses that serve food with alcohol must close by 10 p.m. The later people stay at an establishment and the more people drink, the less likely they are about social distancing. We know that these measures are not welcome by all. We recognize that this is a frustrating setback in our region's efforts to control the coronavirus and reopen. But I want to point out a couple of things and put everything into context. As we have seen a rise in cases and outbreaks this past week, we have noticed that almost half of the outbreaks are coming from two sources: events in people's homes, like backyard barbecues, and from bars and restaurants where people are letting their guards down and not wearing facial coverings or observing social distancing. In addition, we took these actions because we are headed into the biggest holiday of the summer, the 4th of July weekend. Now, we know people are going to want to get out, and on top of that, bars have been closed in surrounding counties like Los Angeles, Riverside, San Bernardino, and just to name a few. Having San Diego bars open exposes us to the risk of larger crowds here celebrating the holiday in our establishments and accelerating the spread of the virus. It is a risk we do not want to take. However, I want to remind people that these few measures are targeted at the area where we have seen the biggest outbreaks. We have not closed beaches, so you're still able to celebrate the holiday at the beaches, although please remember that coastal cities do have the final say on the operation of the beaches. We ask that you wear facial coverings. Pick a good spot on the sand several feet away from other people, and please limit your group to your own household. Again, I know all of this is frustrating, but we simply cannot go on with business as normal while the virus continues to ravage our nation and our community. We often just talk about the virus and the numbers without really getting to understand it. That's why today we have a special guest from the Hospital Association of San Diego and Imperial Counties to tell us a little bit more about what this virus does and how it's affecting not just older people and those with underlying conditions, but it's also hitting younger people who could wind up with a lasting damage for the rest of their lives. First, let's get an update from Supervisor Fletcher.
Thank you, Chairman Cox. You know, across the state of California and across the entire nation, we're seeing significant surges in COVID cases. And while we never thought it would be possible to stop the spread entirely, we do have to limit the spread. We have to slow the spread. This is done out of a desire to preserve the integrity of our healthcare system. And it's worth repeating that it is expected to be a lag between a significant increase in cases and a corresponding significant increase in hospitalizations. Riverside County, which is very close to us, is a cautionary tale of what can happen. They are now seeing an occupancy in their ICUs at 99% occupied. This is exactly what we want to avoid in San Diego County. And so given we've seen an increase in cases, we've seen an increase in the percentage of positive, an increase in community outbreaks, and an increase in COVID hospitalizations, we need to take action now. We need to slow the spread. Data and science drive all of our COVID-19 decision-making here in San Diego County, and it bears repeating some points that were made yesterday. As has been mentioned, when you look at the data of community outbreaks, out of all of the community outbreaks, these are outbreaks that don't take place in a healthcare setting or a congregate care setting, but out of all of the active outbreaks we're facing, the two largest contributors to our outbreaks totals are bars and restaurants and private residents. Those two make up more than 40% of our total outbreaks. The rest come from a variety of different office and business type settings. So the number one source of community outbreaks is bars and restaurants. More than a quarter of all active outbreaks are coming from these settings. And our actions yesterday and the actions that Supervisor Cox alluded to around the time limitations around restaurants, and you'll hear more from Dr. Wooten around, are a very targeted and focused effort to not shut down an entire industry, but take action that we believe will help us slow the spread. Bar-type settings and particular late-night events at restaurants, particularly tied to alcohol, are concerning about the spread. And yesterday I walked through a number of key points the California Department of Public Health has put out for why these entities are particularly risky when it comes to spread, and why these environments likely correspond to the significant increase we've seen in cases from the younger generation. The second largest section of of active outbreaks are private residences. Our public health order already says that people should not be gathering in homes with anyone other than their household unit. But people continue to do it, and we continue to get outbreaks associated with it. And our hope is that the actions we're taking can have people reassess what they're doing inside their own homes to limit the spread and limit the number of outbreaks. And our hope is the actions we're taking surrounding bars and restaurants can simultaneously limit the number of outbreaks and the spread from those two settings. But these two actions alone will not be enough. And that is why we continue to call on the public to please use caution. Please follow the public health guidance. Utilize a mask. Avoid any gathering, particularly indoor gatherings, that are not associated with your household member. Wash your hands, utilize temperature checks, physically distance, because our aim and our intention in all of the things we're doing is to stay open. We don't want to be in a situation where we throw away all of the tremendous progress that has been made. We don't want to be in a situation where we're having to close down industries or sections of our economy that we know are important. And so we're trying to take action guided based on where we're seeing the cases, where we're seeing the outbreaks, and what we think can best help us flatten the curve, which you will see in Dr. Wooten's presentation around the significant increase in cases, percentage of positives, outbreaks, and hospitalizations that we are seeing now. We know this is very difficult and trying times for everyone. Our community is going through a lot. The global pandemic, the economic recession associated with the actions, the social unrest that we've seen, and it is a very difficult and challenging time. But it's our hope that we can come together as a community and support the actions that we're taking that are designed to give us the highest possible chance of remaining open as best we can throughout the duration of this, and ensuring that we don't tip the capacity and overwhelm our healthcare system, which would trigger full-scale shutdowns, which would be the worst possible outcome for all of us. And so in the effort to avoid that, we're trying to take actions based on the data, based on the science, and based on what we're seeing to, again, guide us through this fight throughout the reopening phase and the new normal and the new mindset we're in, where we are actively monitoring and adjusting our actions to try and keep that curve as flat as possible. The other outbreaks that we've mentioned, I've said, have come from a variety of settings. Obviously, bars and restaurants are number one. Private residences who are not adhering to the guidance are number two, and the rest come from a smattering. But they all have one thing in common. All of our community outbreaks to date have come from indoor settings. We have not yet seen outdoor outbreaks from any of the types of outdoor settings, whether that be beaches or parks or protests. Our contact tracers do ask every positive case if they participated in a protest, along with asking other questions to try and ascertain or provide links or connections to the spread. And this could always change in the future, but to date, we have not seen any outbreaks associated with outdoor settings. And that is why, despite calls from some to close the beaches, we do not feel that the public health data supports that action. We do understand that Los Angeles has closed their beaches, and that could entice people to travel here for the 4th of July. But I've spoken to a few of the coastal mayors who all feel confident they can maintain order at their beaches throughout the holiday weekend. Each jurisdiction in San Diego County, of course, has the authority to tighten restrictions on beaches within their cities, but we do not feel that given the setting and what we are seeing, it is a necessary or appropriate step for us to take countywide at this point. But again, we ask for the public's help and cooperation. We know this is difficult. We know that we have been through a lot, but we really have to be mindful of our situation here in San Diego County. We also have to be mindful of the lag or delay in terms of spread, the incubation period, the time it takes for people to get tested, the time it takes for contact tracers to do their work, and often the corresponding increase in hospitalizations we will see after that. Dr. Wooten will walk through some of the additional steps and provide more guidance on the changes to the public health order. We will hear from a representative of our hospital system, but first let's take a look at our daily charts. We'll start today with our T3 charts around testing, tracing, and treatment. Today we are reporting 7,382 tests that have been conducted in the last 24 hours. I want to take a minute to commend our testing team, our T3 team. We have seen significant jumps in our testing over the previous weeks. We now have a 7-day average well in excess of our initial goal, averaging just over 7,800 tests per day. And we think that this is a vital component of our ability to early identify cases and contact trace them. That is made possible, as you see on here, by the 473 contact tracers we now have every day that are working to track down the close contacts and the sources and links to possible outbreaks to guide our ability to manage our way through this. On our next chart, you'll see today we're reporting 317 positive cases. This is out of that 7,382 total for a 4% percentage of positive. This is down from the preceding days. Again, our rolling 14-day average is now at 4.2%. And we will continue to monitor this moving forward. You can see in the purple line there, though, the uptick in the average that is causing a great concern. Next, you will see something else that is causing concern, which is the single highest day of COVID-related hospitalizations we've seen throughout the duration of our COVID pandemic. Our COVID-related ICUs is up to 182, which is the highest ICU utilization we've seen to date. And our total COVID hospitalization is at 493, which again is up higher than any previous day throughout the duration of our COVID pandemic. If you go back just to June 12th, just about 2 weeks ago, you can see we were at 316 COVID hospitalizations. We're now approaching 500 COVID hospitalizations, and this is part of what's guiding our concern and our desire to try and rein in the spread that we see. Next, you will see the total hospital census, the 493 of COVID right there, along with the non-COVID, which has us just under that 4,000 mark. When it comes to ICU, on the next chart, you'll see the 182 that are COVID-related ICUs, the non-COVID ICU utilization on top of that, which brings our San Diego area ICU utilization to 68%. Again, our trigger is 80%, but by the time you're seeing significant spikes in this associated with COVID, it can be a little too late to take action, which is why we are taking the actions that we're taking now out of a desire to preserve the integrity of our healthcare system. That concludes my section of the report. I'll now turn it over to Dr. Wilma Wooten for her Public Health Officer's update.
Welcome, everyone, to the Tuesday's media briefing, and thank you, Supervisor Fletcher, for your virtual update. Global, national, and state statistics are based on the data from the Johns Hopkins dashboard, and these data were obtained today at noon. Globally, there are almost 10.4 million positive cases, including over 507,000 deaths. Nationwide, the United States is reporting over 2.6 million positive cases, now at 25% of the global number, and includes over 126,000 deaths. Statewide, California is reporting almost 224,000 positive cases, which is 2% of the global number, and includes 5,988 deaths. Today, the County of San Diego is reporting 14,149 cases, which is 317 more cases than reported yesterday, which was a record high of 498 cases. This is a decrease, obviously, since yesterday. This includes 365 deaths, and we have 4 new deaths reported since yesterday. The age range remains the same, from 3 months of age to 102 years of age. Regarding the distribution across age groups, there are 7,869, or 56% of the total number of cases are in the age group 20 to 49 years of age. This overall percentage is increasing, and it is increased from just over 50% at the early onset of the pandemic in March to now at 56% after about 4 months. From the very start of the pandemic, individuals in this age group have represented the majority of the cases. Let's examine a review of the various age groups in this age range. Next slide. The 20 to 29 age group make up 22% of total cases. Ages 30 to 39 make up 19% of total cases, and ages 40 to 49 make up 15% of total cases. And as you will see in this slide, if you look at the past 3 months, June, May, and April, you will see the 10 to 19-year-old age group also is increasing, and then obviously the 20 to 29-year-old age group increasing. 30 to 39-year-old group has remained consistently the same at just under 19%, and then you will see a precipitous decrease in the 40 to 49 age group over the past 3 months. Going to the next slide. We also wanted to show the older adults, and we can see for all age groups, there has been a decline over the past 3 months in the total number of COVID-19 cases. So, next slide. What does this all mean? And because of increased openings of different venues, people are going out in larger numbers and interacting with people outside their households, particularly in the 20 to 29-year-old age group. Hence the age group where the largest number of positive cases are being observed. These data contribute to actions that we are taking and will be discussing further in my update. Now, continuing on with other demographics, 7,215, or 51% of the total number of cases are female, and 6,902, or 49%, are male. Of the hospitalized cases, Supervisor Fletcher has talked about today is the largest number of COVID-related hospitalizations. Total hospitalizations of 1,749, or 13% of the total number of cases. Of that number, 485 of the total number of cases have been admitted to the ICU, and this number is slightly over the 3%, over 3% of the total number of cases, and 27% of the total number of those hospitalized. As of June 29th, the county has surge capacity for hospitalization at 36%, which is slightly above where we want to be at 35%, and for ICU admissions at 32% surge capacity, which is slightly decreased from yesterday. Regarding deaths, and if you could go back. Regarding deaths, there are 365 total deaths, which represent 3% of the total number of cases. 42% were female, 58% were male. 345, or 95% of the total death cases had underlying medical conditions. And as always, our sincerest sympathies and condolences go out to the family and friends of all of the deaths reported who have lost their lives from COVID-19, and particularly those deaths or new deaths that we have reported today. In the following set of slides, we will show test cases, hospitalizations, ICU admissions, and death data over the past week since the beginning of the pandemic on the left, and daily statistics on the right for the past 14 days or more. This first slide shows testing, and we can see here that a total number of tests performed for yesterday was slightly above the day before, but we have consistently since June 21st have been increasing our total number of tests. Next slide shows The new cases by date reported, and you can see yesterday was our highest number of cases, and in the past 5 days, we have had, actually, with the exception of today, the prior 6 days, we've had some of our highest positive tests reported. And for yesterday, our number was 317. In the next slide, this slide shows hospitalizations, and while the number of hospitalizations for yesterday was reported at 16, which is consistent with most of the days in the prior week, today again had the highest number of COVID-19 related hospitalizations. In the next slide, on the left side, we show weekly number of ICU patients or cases admitted to the ICU, and on the right side, daily number of cases. And in the past 7 days, we have pretty much an average of about 4 to 5 cases a day admitted to the ICU. In the next slide, this shows our deaths, and again, usually from the weekends, we have 0, and on Monday, usually a low number. So we expect to see the number for deaths to increase even tomorrow and on Thursday. Note that deaths are lag behind hospitalizations, and which lag behind the when cases are identified. And I'd like to remind all of the viewers that all of these statistics are found on our county's website, which is found at the bottom of most of the slides, as well as the sign in front of me. Now I will turn my attention to outbreaks. Since the beginning of the COVID-19 pandemic in San Diego County, there have been 134 outbreaks in congregate settings and community settings. Of the 139 outbreaks, 73 or 53% are now closed and inactive outbreaks, meaning there have not been any associated cases with these locations in the past 14 days or longer. Of the 139 outbreaks, 66 or 47% are still active outbreaks. And of this 66 total, 23 or 33% are in our skilled nursing facilities, and we have 86 in San Diego. We've had 1 new outbreak reported in skilled nursing facilities since yesterday. The second group is related to our non-skilled nursing facility congregate settings, and we have 20 or 30% of the 66 active outbreaks in this setting. We've had no new outbreaks reported since yesterday, and 2 outbreaks became inactive since yesterday. And lastly, we have 24 or 36% of the 66 active outbreaks in community settings, and this is related to one of our triggers that we will get to shortly. We've had 4 new outbreaks reported since yesterday, and 2 outbreaks became inactive since yesterday. Now, in discussions about outbreaks, in the triggers, I'd like to go to the next slide to show our triggers for San Diego County as submitted with our attestation. Metric is 7 or more. If we hit 7 or more outbreaks in the last 7 days, then this is red. So we have had 10, again with 4 reported since yesterday. The outbreak here, trigger number 2, if we go to the next slide, this is a slide that shows the individual outbreaks that have occurred over the past week or so. As I stated yesterday, we had 4. So it's for the last 7 days from June 23rd through June 29th. And as if we have no new community outbreaks identified today, tomorrow we will only have 1 that will drop off, so we will still be red for that trigger. On the next slide, I'd like to show the types of settings for these 10 community setting outbreaks. And as you'll see here, those that are in red are those that were reported yesterday, with the remaining 6 being already on the books. So from, again, June 21st through June 29th. The second column shows when the outbreak was first reported to our individuals that are assigned to the outbreak, and then the third column is when the outbreak was actually confirmed. And you'll see, as has already been stated, there are 2 in businesses. We have a restaurant/bars, 4, and then a healthcare setting, a grocery setting, another restaurant yesterday, as well as a private residence. Going to this last slide, related to the outbreaks, it shows the settings over the past period related to the active outbreak. So April 21st, April 13th, and then most are between June 2nd and June 29th. Again, showing the types of outbreaks: 6 that are in restaurant/bars, 5 that are in residence, retailer, 4, 3 that are in businesses, manufacturers, 2, and then sundry of other categories with 1 each. And at the bottom, you'll see the percentage. So as noted, 23% of the restaurant/bars are represented of the overall number of 26. Next slide. And the last slide. I believe that's the last slide. So again, what does all of this data mean? And as stated earlier, the age group of 20 to 29 years of age, the total number of COVID-19 cases are increasing in this group. This population may represent the largest number of those going to bars and restaurants and having house parties or parties in general, while concurrently not wearing a mask or maintaining physical distancing or taking other actions to prevent themselves and others from contracting COVID-19. Over the last few weeks, we have seen a marked increase in people interacting and gathering in large numbers with individuals outside of their households. As we go into the holiday weekend, we also know that all of our surrounding counties, Los Angeles, Orange County, Riverside, and Imperial counties, are all on the state's watch list and have had bars closed by the state. As a result, it is prudent that the County of San Diego also limits its access to locations where young adults gather for the month of July. Therefore, in our health officer's order, Section 13 states that all restaurants, bars, wineries, distilleries, and breweries shall be closed from 10 p.m. until 5 a.m. every day. Guests already in the facility at 10 p.m. may remain in the facility until 11 p.m., and only staff needed to close, open, or clean shall be in the facility between 11 p.m. and 5 a.m. It is important for everyone to understand that the pandemic is not over and the virus is still pervasive throughout our community. It is still widespread, and the increased number of cases show this. Whatever age group you fall in, it is vital that we remember that our actions have power and can save lives. Wear a face covering, maintain physical distance, wash your hands, and please no dinner or house parties or gatherings of individuals that are not of the same household. Now more than ever, it is vital that we all take precaution and play our part to prevent the spread of COVID-19. Now please welcome to the podium Demetrius Alexiou, who's the President and CEO of the Hospital Association of San Diego and Imperial Counties. Thank you.
Good afternoon, everybody. My name is Demetrius Alexiou. I'm President and CEO with the Hospital Association, and I'm fortunate to be able to represent and work with all of our hospitals in both San Diego and Imperial counties. And I'm here today with a couple of messages. First, our hospitals and health systems strongly support the recent public health orders. We definitely support Dr. Wooten and the decisions that have been made utilizing science and data. We also would urge the public and businesses to be self-disciplined with enforcement, as none of us want to see more businesses impacted. Throughout the COVID-19 pandemic, our hospitals and health systems have been in constant communication with the County of San Diego and our health officer. It's important to remember that the goal throughout this pandemic has been to protect the health of our region and our community, as well as preserve hospital capacity. The recent trends that we're seeing are putting that second item at risk. In the past week, we've seen hospitalizations go up from about 300 or so to well over 400 now, and there is no end in sight as those trends continue to go up. I know it's already been said, but it's important to remember that even with the positive cases, those lag, so eventually we could see more hospitalizations as we continue to have high case counts. The other thing that we've also seen is higher positive test rates even through our hospital labs, and increases in terms of ICU utilization, which creates particularly tough challenges in that we have a limited ICU capacity as staffing for ICU becomes a challenge, as well as PPEs. So it's important to note that, just in closing, our hospitals do urge the public to do some of the simple things like wearing a mask, social distancing, and washing your hands. Doing those simple things can make a difference in ensuring that we maintain our hospital capacity to serve our region. Thank you.
Thank you, Demetrios. We'll go directly to the questions now.
Anthony Pura with 10 News, please state your question.
Yes, hello. Can you talk a little bit about the enforcement and penalties in relation to the curfew? Will there be an education period for restaurants before the enforcement begins? And if so, how long will that education period be? And then I have a second question as well, just because you've alluded to the fact that these orders are coming in place because we are worried about visitors from other counties, and I suppose Arizona as well, because they are having an uptick and stricter, or uptick in cases, and have instigated or installed stricter laws. Does that mean that we have to wait for those counties and those other regions and states to improve first before we feel comfortable in reopening again?
Okay, I believe Dr. Wooten's going to respond to that question.
So thank you for, there are numerous questions there, so I'm going to start at the end, and you may have to repeat the first one. In terms of this order will be effective beginning, today's Tuesday, beginning tomorrow. So effective at midnight, which is Wednesday, so tomorrow morning. So it's effective tomorrow. And our Department of Environmental Health, as well as we've engaged our restaurant association. So the closing, it's just a matter of changing hours for closing. Everything else actually continues as is already in place. Now, the question about Arizona, obviously, given the fact that this order is effective as of tomorrow, the question about Arizona was when would we reconsider, I believe, the lifting July. We will just have to continue to examine our data and determine when things will change. That was a time period that we provided, but again, it depends on what our numbers and our stats look like at that time. And I'm sure I missed one of your questions. Could you repeat it, please?
Yeah, I wanted to ask about the enforcement and penalties in relation to the curfew. Will there be an educational period for restaurants before enforcement begins? And if so, how long will that education period be? I know they start tomorrow, but usually in the past, they're given some kind of warning before any type of penalties incur.
So in terms of penalties, we are asking, well, In enforcement, we are looking at that on several levels. First, we want the businesses to help with enforcing the regulations as outlined in the health officer's order. Obviously, the law enforcement in the various jurisdictions where restaurants and bars are located should be doing that. And as stated at the very onset of this outbreak with our health officer's order, fines are just a misdemeanor and subject to a $1,000 fine. So in terms of education, as I stated, I think in my first part of my answer, this goes into effect tomorrow. So if individuals or businesses rather have questions, but our Department of Environmental Health has been working with the Restaurant Association, and they will continue to work with restaurants that have questions about implementing this order. But again, in general, nothing has changed except the timing of when the business closes.
Okay, thank you. And to clarify, this only applies to restaurants that serve food. The curfew applies to them, but the bars, wineries, and breweries that do not serve food are still ordered to close at midnight tonight.
That's correct, sir. But many bars, wineries, and breweries, as well as distilleries, do serve food, or they have the option, actually, which has been approved by the state of California, to develop relationships with restaurants or food trucks, so they can do that.
Okay, thank you.
Mm-hmm.
Let's go to the next question.
Yes, Matt Hoffman with KPBS. Please state your question.
Hi, sort of a follow-up to that. I know yesterday you guys said that bars, breweries, and wineries that they have to have a food license, and I know that caught a lot of owners off guard because they're partnering, like they said, with food trucks and stuff. So you guys are saying that you guys are clarifying that the actual breweries, bars, they do not have to have a food license themselves. As long as they can partner with someone, they can still stay open.
Yes, that's what we're saying. Okay, next question.
Anna Gomez with Frontera Newspaper. Please state your question.
Hi. According to the county dashboard, COVID-19 cases remain higher in border and South County communities like Otay Mesa, Chula Vista, and San Isidro. So are there any specific measures to mitigate these cases in these specific areas? And do you think these higher numbers are related to U.S. workers that live in Tijuana and go back and forth to San Diego on a daily basis?
Okay, Dr. Wooten's going to respond.
I think the first point to make is that South Bay is more populated compared to the rest of the county, so we expect to see more positive cases in that region. If individuals are coming from Tijuana, and we know that many individuals are working at various manufacturers, but if they're not being tested, then they don't contribute to the overall number of tests. So again, nothing has really changed in terms of the populations. We expect to see more tests as we are testing more in that region, and more than 50% of our test sites are located in the South Bay of San Diego County. And Dr. McDonald has a comment.
And are there any specific measures to mitigate the cases in these high population areas?
Yeah, hi, this is Dr. McDonald. I was going to add a couple of comments, and I think you might know, there were some hearings conducted by the State Senate today regarding the impact of COVID on the border region. There was some wonderful testimony from really across the stakeholder spectrum, and I think it might be still having some public testimony going on now. I will tell you that that we are specifically, increasing testing, increasing outreach. There has been a specific PSA ad campaign that's going to be developed, and it hasn't been deployed quite yet, but it should be deployed almost immediately to actually directly address the public. We certainly have been mentioning the disproportionate impact in the South Bay for over a month and a half here at these news conferences. So certainly, with your help getting the news out through the news media, that this is the most impacted region. Some specific things the county has been doing: we've worked with employers who have essential employees who live on both sides of the border. Some of those outreach activities have been because of specific outbreaks, but this has given us a lot of experience to then work with like employers to give them information, the latest from both the state and the CDC, that has been adapted by us locally to be sure that they have those resources. Certainly, we're trying to make as many resources available in Spanish as possible, and that's an ongoing process. But again, I think that if you look at the way we have certainly emphasized the disproportionate impact in the southern zip codes in the county, especially those directly on the border, it is definitely a high priority for us and an emphasis for us.
Thank you.
So this is Dr. Wooten again. Dr. McDonald triggered something. When we started having outbreaks in manufacturers that were, and food sources, companies that were in the South Bay area, I sent out a health officers a letter reminding them of the best practices, public health best practices to implement to protect their workers and to recommend that they get tested. But however, I'm not certain about the testing capabilities or if they have had their workers tested, but we did send them information to help educate them so that they could educate their workers. I also wanted to point out that we are also working with the Health Equity Task Force. They actually will be meeting soon, and also the Filipino Task Force to help educate those various populations so that they can get information out to the individuals that they represent. Thank you.
I also might point out that almost half of the test sites we have in San Diego County are in South County. In fact, today in National City, through the efforts of Mayor Alejandro Sotelo Solis, we opened up a new testing site in National City. It's actually the 5th site, and very shortly we're going to be opening up a new test site in Imperial Beach. Let's go to the next question.
Taryn Mento with KPBS, please state your question.
Yeah, I know that my colleague at 10 News was asking about this, but I'd like to drill down on it a little bit further. Related to enforcement, yesterday you all said that you were specifically reaching out to law enforcement agencies to talk about increasing enforcement, stepping it up. So can you be more specific on what direction or request or what you're communicating to law enforcement agencies on what to focus on?
Okay, Dr. Wooten's going to respond.
I think someone made the comment, we have a lot of regulations in process and they just need to be enforced. So we are working with law enforcement across the various jurisdictions to just ensure that they understand what the health officer's order states and that they reinforce the requirements in terms of the closing, and also individuals wearing facial coverings and social distancing. Nothing's changed in terms of the public health best practices, but in terms of the language that's identified in the health officer's order, being aware of what that is and helping to reinforce that, as well having our restaurant association ensure that they reach out to all of the businesses so that they understand what the regulations are, and that would be done through our Department of Environmental Health.
So it does sound, just I have one follow-up question, it does sound that there is still a strong emphasis on educating and communicating over citing at the moment. So, and then the second part of the question is, if you can confirm that. The second part of the question is, I see how that this can be done with businesses, but when we know that the second largest source of outbreaks is coming from private residences, how are we addressing that problem?
Yeah, well, certainly, we don't have police that are going out to individuals' private residences, but I can tell you that we get information from the private citizens that are observing the fact that there are parties in the neighborhood. So sharing that information with us, but I'm not asking people to go and confront anyone. But just sharing information. So this goes back to our prior statement that everyone has a role to play, and if everyone plays a role, we can address this issue head on and can make a difference.
Thank you.
Mm-hmm.
Might add that the Sheriff's Department is working with the other law enforcement agencies in the county, and they'll be making their decisions in regards to enforcement. Next question.
Priya Shriver with NBC7, please state your question.
Hi there. Yeah, we looked at some data that showed that San Diego County had the 4th lowest testing rate in the state compared to the other counties, with 93.8 tests per day per 100,000 population. And in comparison, we saw that Orange County is doing 147 tests per day. Los Angeles is doing 212. San Francisco is doing 329. Why are our numbers so low still?
Is going to be responding to that question.
Thank you for that question. For the approximately last 2 weeks, we were averaging on our 7 days over 7,000. Truth be told, is even about 4 weeks ago, we were in the 6,000 range. Part of this, of what you're seeing on the state reporting, is some of the results that the state's putting together. We have elevated this to the state. How we compare, I can't speak for Orange County or in LA, but our results as an urban county, where we need to be, as Supervisor Fletcher pointed out, of the 1.5 to 1,000, which is about 4,950 tests, we achieved that about 6 weeks ago. And then the 2 per 1,000, which is about 6,600 tests averaging per day. Obviously, now the last 14 days we've achieving that. So as the urban county, we're probably one of the highest performing urban counties. So I would go back to that source of how they're collecting that data. But our data is comprised by our county public health lab, all the great work that our hospitals are doing, one of our community clinics, and our commercial lab. And so we gather all that data through our EPI department, and that's the results that we share with you.
Thank you.
Okay, next question.
Yes, Paul Sisson with the San Diego Union Tribune. Please ask your question.
Thank you. You reported today the highest single-day hospitalization total that the county has seen since this pandemic started. I know that you met with hospital CEOs yesterday. What can you tell us about when the county might order hospitals to start canceling elective procedures?
Dr. Wooten.
Thank you, Paul, for that question. We actually met with a subgroup of the CEOs yesterday because we were getting their feedback, as it is a continual process, on our metrics. So that was the purpose of our meeting yesterday, and we actually did have a discussion about elective surgeries, and we're looking at other options, but at this point in time, elective surgeries are not on the table, and that's what came out of our discussion with the hospitals yesterday.
Is there a certain threshold percentage where you would start considering that? I know you have some thresholds in your daily metrics that you put out.
Yeah, hi, Paul. I'm going to pick up where Dr. Wooten started there. That the issue about elective surgeries is really the impact on perhaps the use of PPE and perhaps the use of hospital beds and ICU beds. And really the decision-making within the hospital of prioritizing what procedures need to occur so that it doesn't impact those needed resources for COVID patients is really a system-by-system thing. And really the hospitals are doing a great job of actually managing this with themselves. And the term elective surgery, again, is a little misleading because what might be an elective surgery now turns into an urgent surgery with time. And the need to prioritize a specific elective surgery versus another, again, is something that physicians are doing inside these systems. And so really, rather than having the county impose a barrier from the outside, the hospitals are doing a great job of actually managing this balance themselves. We discussed this with them, and right now that balance is a fine one, and they do, each system is dialing the dial as needed to be sure that enough capacity for a COVID surge exists. So those are ongoing discussions, and again, I think it's really important to know that system by system, it has those impacts. Early on, we were much more concerned than we are now about the PPE impacts. Right now, it is about the bed capacity impacts. And again, those types of decisions are best made within each system, and those systems are giving us daily feedback to be sure that if we need to do something as a county, we will do it with them.
Another question. A lot has been said about outbreak lag times. You know, basically the idea that infections that occur might not be picked up for weeks. Do you have any better data now on what the average lag time is from when somebody gets a test to when the county reports a positive test to the public?
So Paul, we're going to have staff bring up actually the table of the outbreaks, the community outbreaks where we're currently at. But before I go into that, I just wanted to add one thing to what Dr. McDonald was saying, and from our conversation with the CEOs from the various hospitals last evening. They have, as Dr. McDonald said, they are determining what procedures they need to perform, and many of the procedures are really not elective, but they are urgent or procedures that have been put off and need to be implemented. So that's another thing that's also figuring into what some people might think falls under elective surgeries. So we're letting the hospitals tell us, and it will vary from hospital to hospital system, but they are helping us fill in that information as it relates to our triggers and what actions would be taken. So just wanted to add that additional information. Now, as it relates to the outbreaks, you can see here, and I explained this in the update that I made, first of all, and actually there should even be another column, because the very first case, usually you don't have all three, and that is the requirement for community outbreaks, 3 cases from 3 different households. You might get one case. A week later, you might get another case associated with any of these settings. And once there are 3 cases, then it is assigned to an outbreak team, and then they do their due diligence to confirm if this is an actual outbreak or not. So you see here for the 10 community setting outbreaks that have made us have a trigger in red for number 2. You can see the dates on when it was assigned, was reported, and then when it was confirmed. So it could vary. It could be within a 24-hour period, as the last 8 are, or it could take us several days, depending upon the size and the type of business or facility that is where the outbreak might be identified.
I guess I was just wondering, in general, for all positive cases, what the average lag is from the time you take a sample to the time you can let us know about it.
That could vary, Paul. As I stated before, if you have 1 case, you have to wait until you get 3 cases. We look at it within a 14-day period of time. And that's now, if you have the 3 cases within 14 days, then that's the definition of an outbreak.